It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, a new group is fanning the flame of entrepreneurial doctors. The Society of Physician Entrepreneurs is a national nonprofit, and a Hoosier doctor and university professor are launching an Indiana chapter. Kylie Valletta has more in the Business of Health. Kylie?
Thank you, Gary. The co-founders of SoPE Indiana say healthcare is a hotbed of potential entrepreneurs, but many medical professionals lack the business expertise to move their ideas to the marketplace. The newly formed nonprofit aims to give them the tools they need to begin a business. Dr. Todd Saxton, an IU Kelley School of Business Associate Professor of Strategy and Entrepreneurship, and Dr. Paul Zotek, a hernia surgeon, are the co-founders of SoPE Indiana. Thanks for being here today.
Thanks for having us.
So let's start with you, Paul, because you have an interesting story. In addition to your day job as a surgeon, you also tried to start your own venture.
Sure. It began in 2014 with the advent of Google Glass. I was one of the early explorers and saw a potential need for training other physicians with that, and tried to start my business with a partner, and had really no team, had no strategy. We just put some startup seed money in, and it failed miserably. So at that point, I realized that I needed to do something else to not only supply my own entrepreneurial spirit, but and educate myself, but also to help all the other physicians out there. I think we have an excellent idea and hands-on of what patients need us to take from the bench to the bedside, but we don't have the vehicle to get it there. And so as I took on the physician MBA at the Kelley School of Business, I met Todd, and we began to work towards a group such as SoPE that can provide the infrastructure and the ecosystem to get physicians that learning experience to provide that bench to bedside conversion.
And you mentioned the physician MBA program, which you teach for. So yes. Tell us, as you teach these doctors, what do you observe?
One of the more interesting things, which I'm not sure we as patients are aware of, is that I think physicians are every bit as frustrated with the healthcare system as we are, and are really looking to change it. You had focused a bit on starting a new business, but I kind of see a couple different categories of folks in our program, and I've gotten a much deeper sense of what their journey looks like as clinicians trying to innovate. And some of them, like Paul, are trying to start a new business or spin something out of their existing practice or network, but many of them are just looking to try and be change agents within their own organization. And many of the same skills and tools are needed to be able to push through innovation internally, as well as launch a new venture and raise interest, advocacy, get feedback, and then fund it. So I think there's kind of a common interest and passion for changing healthcare for the better, whether that manifests in a new venture, a new product idea, or an innovation within an existing system. And hopefully we're providing some of the tools to allow them to do that within Kelley. I think there's an opportunity through SoPE to have a much broader impact on the healthcare community in Indiana. There are a lot of physicians out there that maybe for whatever reason aren't able to take the time and energy to get the whole MBA, but at least SoPE can help them build that toolkit.
Well, let's talk about some of those tools, the function of SoPE. What are you going to do to help doctors overcome some of these hurdles to launching their own company or innovating?
Sure. Well, I'll start. As you heard from Paul's story, initially entrepreneurs, and this is true in healthcare, outside of healthcare, engineers, whatever, tend to focus on the problem or the product, I should say, or the technology that they are developing, and don't really understand necessarily the full context of the customer experience, but also aren't connected to the funding sources and other pieces that can help them be successful. So I tend to think of it in terms of kind of degree of separation. Everybody with an idea is 3 or 4 at least degrees of separation from the people they need to connect to be successful. I think if SoPE as an organization can bring those pieces together in a little better fashion to shorten those degrees of separation from 3 or 4 to 1 or 2 degrees, you can more easily connect to the people to give you feedback, again, connect you possibly to dollars and a deep understanding of the customer problem that can allow you to launch and grow your venture more successfully.
And Paul, we have just a few seconds left, but we want to make sure we mention this isn't just for doctors.
Correct. We're interested in all healthcare providers or anybody in the healthcare field to join the group and participate. We appreciate all comers, and I think the name says physicians, but we're really interested in all healthcare providers.
Well, Paul and Todd, thank you both for being here today. And I know you're just getting off the ground, but hopefully we'll have some new entrepreneurs soon.
Absolutely. Thanks so much.
Gary, back to you.